Hey everybody, welcome to today's blog post. I want to talk a little bit further about non-surgical decompression, chronic low back pain, sciatica, disc degeneration, different things like that, different things that can affect your low back primarily, but can also affect your neck. Now yesterday I gave you kind of a drawing of a very, very basic concept of how the disc works. So I want to show you on a model here. This is a model of a healthy spine. So you'll see you have bone, disc, and bone, and in between the bones there's a space right here that these nerves come out of, and these nerves come off of the spinal cord. So the spinal cord runs down, and then these nerves will come off the spinal cord, and they go out and they control and coordinate the function of every cell in the body. So this is what a healthy disc looks like. You've got your nucleus pulposus that I was talking about. I don't know if you can tell. Do you see those rings on there? Those rings are the strength that I was talking about. So when you have a force that comes down from the top of your body or through bending or something like that, these rings are what gives this disc the strength. And there's a gel in here that acts as the cushion. So when you start the phases of degeneration, the first thing that happens is you'll start the disc will start to starve a little bit, and these fibers will start to get weak. And as they get weaker, then we move into a situation like this. As you can see, the gel and the stuff coming out of the disc here is starting to leak through the fibers. And as it leaks through, it'll take this material here and it'll bulge it out. And what you'll end up with is a bulging disc that'll come out in between the bones right here. And if that disc goes off and closes off part of this hole, that's going to put pressure on that nerve. So everything that nerve goes to is going to either have a radicular symptom like pain going down the leg, or it's going to cut off some of the function going to that organ. And a lot of times you'll see people that have a chronic disc issue, you'll see, one leg is smaller than the other. That's because the muscles have atrophied, which means they've kind of shrunk. They've lost some of their size and their mass because of lack of use. So basically that material has leaked out of the disc, or leaked out of the nucleus, gone through these weakened fibers and into the outside part of the disc, causing that bulge and putting pressure on the nerve. So what do you do about this? Well, there are several options. Like I said, there's conservative chiropractic care, which helps in most cases, but there are times that doesn't help. I've seen patients back when I used to do a lot of advertising for decompression who came in and who had chronic issues and had previous chiropractic care that was just non-resolving. Hold on one second. Hey, can I call you right back? I'm shooting a video. Okay, call you right back. That was Kelly. So what happens is we use non-surgical spinal decompression in the office. And what decompression does, I'm actually going to put a video up that will show a patient on the machine. But basically what it does is it starts a traction process, and when the traction comes in, the difference between decompression and traction and inversion is that whenever you have an injury to a joint, if you start to pull on that joint, the muscles around it are going to tighten to protect it. So if you use traditional traction or an inversion table when you have an acute injury like this, or what we call a hot disc, it can actually increase the damage, because when you start pulling and those muscles start spasming, those muscles can increase the pressure on that disc and cause it to bulge further. So inversion is a great therapy. I'm going to go over that a little bit later in another video. It's a great therapy, but it's not good if you have a hot disc. So what you do with a decompression machine, and this is why decompression is more costly than traction and inversion tables, is whenever that machine starts to pull and those muscles start to tighten up, the machine will sense the constriction and it'll lighten up on the pressure. So those muscles can relax again and the machine will pull, and eventually it'll work through where those muscles aren't tightening anymore, and it can get into this vertebral joint and actually start pulling it apart. And it kind of pulls and lets it go, and pulls and lets it go. And what that does is that starts that suction process that we talked about, which was imbibition, and we talked about that in the last video. And by creating that imbibition, then that disc actually starts to get fed again. So it can start getting its nutrition again and start to heal a little bit. And some of those fibers may actually start to heal a little bit. Some of that disc material may imbibe back into the body and imbibe back into the disc and actually get the pressure off the nerve. In most cases, what ends up happening is you get relief of your symptoms, and it's without drugs, it's without surgery, and it's without side effects, other than maybe a little bit of soreness when you first start. And then once you've gone through a decompression protocol and you start feeling better, then the important thing is to maintain your adjustments to keep that joint functioning so it doesn't go back to where it was, and do a good strengthening program, which we do here in the office with our rehab equipment. Do a good strengthening program to prevent this from happening again. So that's the option with non-surgical spinal decompression and how it works. Now, as far as the medical route, and sometimes the medical route is necessary. This is not a bash on the medical route. It's just my opinion that you go with the least expensive and the least invasive, and you work your way up the spectrum when things don't work. And most of the time we can stop it with chiropractic. If we can't stop it with chiropractic, we can stop it with the decompression and the laser. And what the laser does is the laser helps with the inflammation and helps speed up the healing process as well, along with different nutrients like manganese and different supplements like Ligaplex that can help support the ligaments and help support the body healing. So the medical route, if this fails, or if you choose to skip over the less invasive routes and go straight to the medical route is they go in with needles. One of the techniques they use, they go in with a needle and they actually inject a steroid into the area of the nerve root to try to deaden that nerve and get the inflammation out of there. A lot of side effects to that. It increases your risk of osteoporosis, increases your risk of avascular necrosis, and most of the time the benefits are very temporary at best. Another option they have is neuroablation, where they actually go in and they burn the nerve to try to kill that nerve so that it can't create the pain impulse anymore. And then, the other options are you start getting into surgical prevention or surgical procedures where they go in and they can do a small procedure where they go in and actually shave the disc off. But then sometimes you get into the massive procedures where they actually go in and fuse the vertebrae. And the problem with that is a lot of times it doesn't work, and if it doesn't work, then you've got physical damage on top of the injury that you have to deal with. And in the case of a fusion, it will limit the motion of this joint, so then the joints above and below it have to start carrying the load of the joints that have been fused, so they start to wear out, and eventually it could lead to more surgery and more surgery. So that's how decompression works. And like I said, I'm going to post a video that shows a patient actually on the decompression machine. It's an older video, but it's our decompression machine. It's a patient that we were treating a while back, so I'm going to go ahead and post that up there so you can see what that looks like. And I hope you find this information useful. If you know of anybody who's suffering from a disc injury or herniated disc or sciatica or something that's not resolving, let them know about us. We might be able to help them. I'll be glad to check them out and chat with them and see if there's something I can do. Okay, that's for our video for today. As always, my hope for you is that you take control of your health before your health takes control of you, and I will see you guys next time. Have a great day. Bye-bye.